Hi, my name is Andrea.
My name is Mallory.
My name is MayLinh, and our group diagnostic assignment will be on Arturo Rodriguez. Arturo is a 4-year-old Hispanic male. His mother was referred to our agency through a priest at a Catholic church the family attends. The mother explained that her son has had a change in behavior since her husband was detained by police. While at work, um, police raided the family's home and arrested the father. Arturo was a witness to the events before being taken by Nadia, who is his 16-year-old cousin and babysitter while the mother is working. Since witnessing these events, Nadia and the mother report Arturo experiencing nightmares, a fear of strangers, as well as fits that included screaming and crying. Arturo seems to have difficulty sleeping, an increased attachment to his mother, and is not as affectionate as he once was. His fear of strangers increases, especially around policemen. In addition, Arturo has begun to wet the bed. During play therapy, the child will enact a scene where someone or something is lost and must be found. This was an observation also made and reported by Nadia. Cultural considerations that should be considered when working with Arturo and developing intervention and treatment plans include being mindful of the family's religious affiliation as well as the Hispanic culture. It is also worth exploring the status of the family, as being an undocumented immigrant comes with its own challenges and experience. Recognizing the client's Hispanic culture is important, given that as of 2008, 46.9 million citizens are of Hispanic descent. Tactics that can be used are coordinating community outreach efforts, as well as utilizing bilingual media and being sensitive to the language used and its cultural meaning.
So, through group discussion, we concluded that Arturo's diagnosis is PTSD. Arturo's presenting symptoms align with the diagnosis and the DSM diagnostic criteria for PTSD. His presenting symptoms include nightmares, difficulty sleeping, fear reactions towards strangers, which correlates with what his mother was saying about when he sees somebody that he doesn't know, he kind of jumps out of his skin, hiding in closets when people come to the front door, and the fear of normal daily living stimuli. The DSM diagnostic criteria for under 6 years old includes reoccurring memories and dreams of the event, dissociative reactions, distressed or adverse reactions to similar or normal stimuli, and shifts in moods and behavior. This relates to what happened with Arturo in the play therapy of him hiding objects and looking for them. The DSM notes that PTSD in under 6 years old stems from observing the event happening or the event happening directly to a family member. And Arturo's cause of his PTSD is from watching the police come to the front door, raiding his apartment, arresting his dad. And that all started that stemming of the present behaviors that he's exhibiting.
The other possible diagnoses that we were thinking about were generalized anxiety disorder, and this was an option because some of the symptoms that are being displayed line up with this diagnosis, like the sobbing, being jumpy, the new fear to strangers, and the changes in attachment. This is not the correct diagnosis because all of these symptoms are a trauma response to a traumatic event that happened. And these symptoms have also not been present for more than 6 months. And there is no sign of irritability or muscle tension when he is escalated. The other option was adjustment disorder. The symptoms that line up with this diagnosis are being jumpy, new fear to strangers, changes in attachment, having potty accidents, nightmares, and difficulty sleeping. And this is not the correct diagnosis because there was a traumatic event that these behaviors resulted from, as well as there being no report of any academic delays and no report of symptoms being present for more than 6 months.